Hi, this is MJ, the coding coach, and I am back to finish the chart. So here's part 2. So we stopped off knowing that I-13.2 is for hypertensive heart and chronic kidney disease with heart failure in stage 5 CKD or the end stage renal disease. And we know from the chart, the patient is on renal dialysis. So anytime the patient is on renal dialysis, you know that they have ESRD. Regardless of the stage that the provider put in the medical note, if they're on dialysis, you know that it's ESRD, the end stage. So we also included the heart failure unspecified. And the reason it's unspecified is because in the chart, it does not specify the kind of heart failure. So when something is not specified, we use the default code of unspecified. For an example, we have diastolic heart failure, systolic heart failure. There's left heart failure. There's different types of heart failure. So by the provider not telling us what kind of heart failure, it's going to be heart failure unspecified. So again, we have the N18.6 for the ESRD. And again, anytime a patient is on renal dialysis, you're going to code Z99.2 for dependence on renal dialysis. So going back up here to what we have, we found in the chart shortness of breath, edema, hypertension, diabetes, peripheral vascular disease, cardiomegaly, chronic kidney disease, dialysis, and heart failure. So you see we've already coded for numbers 3, 6, 7, and 9. When you're looking for disease interactions and trying to figure out if you're going to use a combination code, if the provider says diabetes with PVD, diabetes and PVD, or PVD due to diabetes. All of those context clues, they're called conventions. All of those with and due to, that means there is a disease interaction. So we're going to use E11.51 for diabetes type 2 with diabetic peripheral angiopathy without gangrene. That's what we're going to use. And that's the same thing as PVD. So when you see the code E1151 in your book, and it says diabetes type 2 with peripheral angiopathy, it's the same thing as peripheral vascular disease. The patient also has chronic kidney disease with the diabetes. So we're going to use the code E1122 for diabetes type 2 with chronic kidney disease. So you will need to read your instructional notes to see if you need an additional code. But E11.51, that's for both the diabetes and the PVD. E11.22 is for the diabetes and the CKD. Now, I have worked at some companies where they want me to use the combination code and still add the PVD code as well. Sometimes it depends on company rules, but E1151 is very much sufficient, and it shows that this patient has diabetes and PVD. E1122 says this patient has diabetes with CKD. And we'll also notice if you go into your book, I'll give you a minute, go grab your book. You see here for E1122, type 2 diabetes with diabetic chronic kidney disease. If you also read your red instructional notes, it's going to ask you to code for the stage of CKD. It's going to either be stage 1 through stage 6. Here's the PVD code, E11.51, diabetes type 2 with diabetic peripheral angiopathy without gangrene. And if you look at that E1152, that's diabetes type 2 with diabetic peripheral angiopathy with gangrene. So it's very specific. So make sure you pay attention to the specifics of each code. One word can change the meaning of the entire code, and one word can change the actual code. You see, this is E1151 and E1152, and the only difference is with or without gangrene. So you have to pay attention. So as we wrap up the scenario again, you can see it here. The codes we're going to use is I13.2, I50.9, N18.6, Z99.2, E1151, E1122. And when we look up here to our list, we've scratched off everything we needed to code. And again, we would not use that E11.9 because that's diabetes without any complications. And we know that this patient has 2 diabetic complications. So here are a few notes to keep in mind. Only use E11.9 when there aren't complications. If diabetes is not specified, whether it's type 1 or type 2, always assume it's diabetes type 2, and that's per your guidelines. If you're reading a medical record, see, like this one, the patient, it said diabetes, but it didn't say whether it's type 1 or type 2, and we know that there are different types of diabetes. So since type 2 is the most common, then you would naturally assume that the provider is speaking of diabetes type 2. That's in the guidelines. Again, regardless of the stage that's reported in the medical record, if the patient is on dialysis, always add N18.6 and Z99.2. I hope this video was very helpful. If you have some questions, make sure you drop them in the comments, and I'll be great about swinging back around and answering whatever questions you have. This is MJ, the coding coach, and I am out.